Hello there, and welcome. My name is Calliope, and I'm going to be performing your annual physical examination. So to start here, could I just grab your name and date of birth, just to confirm? Good, and then there we go. And is that the name you prefer to go by? Okay, wonderful. Let me just jot it down. All right, so to start, I have a little questionnaire for us to do, and it's just asking questions about your general health, your family history, things like that. So, do you have any current pain or illness at all? Okay, good. And any current health conditions like asthma, diabetes, COPD, emphysema? Okay. And now I'm going to be asking some different lifestyle questions. Firstly, do you use any tobacco at all? And if so, how much on a given day? Okay. And how about cannabis use? This could be things like gummies, it could be even things like those CBD little pills or drinks, anything that has cannabis in it. Okay. Okay, and any recreational drug use other than cannabis at all? Okay, I promise that I'm not a narc. This is just more for making sure if we prescribe any medication that it doesn't have any interactions. We can look for any associated health problems with any recreational drug use. We're not here to snitch, okay? Okay. It's just for medical purposes only. All right, and any alcohol use at all? And if so, how much on a given day? Excellent. And how would you describe your diet? What does your diet typically look like? Okay. Okay, and what about exercise? What does exercise look like for you on a given day or throughout the week? Okay, excellent. And let me just look here. So we're up to date on, the DDEP, the MMR. Okay, so we are all up to date on any vaccinations currently. Do you have any allergies at all? Okay. And what does any current medication use look like, including supplements or like a multivitamin? Okay. And that's just the once a day? Excellent. Now, any family history of any serious or chronic illness, like asthma, like cancer, like COPD, emphysema, diabetes, anything of that sort? Okay. And what side is that on, maternal or paternal? Okay, and Okay, excellent. And lastly, any surgical history at all, even something as simple as getting your wisdom teeth out. Okay. Very good. Okay. So our nurse went ahead and took some of your vital signs here. I just want to take a look. Make sure those are all good. So we have a BP of 110/70 millimeters of mercury, a 98 oxygen saturation rate, 68 beats per minute for heart rate, 14 respirations per minute, and a 98.4 temperature. So, for our actual examination now, I just want to have a little look at you, just to make sure I don't see anything outwardly out of the ordinary. Or if I do, we can hone in on that when we get to the appropriate section of our exam. Okay, and then we are going to be starting with the chest here. Now, we are going to be using the stethoscope, and I'm going to be using my hands to examine the chest. The first thing we're going to do is I'm going to use the heel of my hand here, and I'm going to place it on your chest. And we're going to feel for a phenomenon called heaves. Good. And then using the flats of my fingers here over the valves, we're going to be feeling for thrills, which are palpable heart murmurs. And down here at the mitral. Good. Okay, now we're going to be doing some auscultation. And I want to listen to your valves with both the diaphragm here, which is used for higher pitched sounds, and the bell of the stethoscope used for lower pitched sounds. So if I could just have you breathe normally here. We're listening to the valves open and close, open and close, close. The pulmonary valve. Good. Right here at the tricuspid valve. Good. And the mitral valve. Good. And then we'll just switch to the bell. So, the aortic to start. The pulmonic. The tricuspid, and the mitral. Open, close, open, close, open, close. Good. Just for a moment, we are going to put this away because we are going to do a few tests on your lungs before we listen. The first one we're going to do is the chest expansion test. I'm going to put my hands on your chest with my thumbs at the same level. I'll have you take a deep breath in, and they should expand at the same distance as you inhale and come in together simultaneously as you exhale. If we were to inhale and one is much more expanded than the other, then that's an issue. If we don't really have that much expansion, that's an issue. So I'm going to squeeze tight here. Alright, I'm going to have you just expel all the air out of your lungs. Okay. And I'm going to have you take a very deep breath in and out. Deep breath in and out. Okay, so my thumbs moved bilaterally in and out. Now, I'm going to be tapping on the chest wall, and this is known as the percussion. We are listening for the sounds that come back after we tap on the chest, like if you were gauging liquid in a barrel. You tap on it to hear how much liquid is in it. It's based on the same principles. I'm going to start up here, move over, down, over, down, over, down, over, down, over, down, and over. Excellent. So we listen for the different tones that come back. We want a resonant tone, but if something's wrong, we can get hyperresonance, we can get a dullness, or a stony dullness. But everything there is nice and resonant. So now, we'll auscultate the breath sounds. We're going to listen for things like wheezing, rhonchi, crackles. So I'm going to start at the lung apices. I'm going to have you take a deep breath in and out. Good. Deep breath in. Out. Deep breath in. Deep breath in and out. 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 Good. If I could have you flip for me so that we can do those same tests on the posterior chest wall. Okay, so chest expansion. I'm going to hold on real tight here. If I could have you exhale all the air out of your lungs. Good, and real deep breath in and out. Deep breath in and out. Okay. We had our simultaneous bilateral motion there. Let's do some percussion here. Good. And a deep breath in and out. Deep breath in. Deep breath in. Out. Deep breath in. Deep breath in. Out. Deep breath in. And out. Excellent. So, let me jot some things down here in your chart. So, let's see. Upon palpation, no heaves, thrills, and good heart sounds across the valves. And bilateral. Good. Okay, upon percussion, resonant. Okay. So now we're going to move on to your head and neck. Let me grab. I need this and I need this here. We're going to take a little peek inside of your mouth. So, if I could just have you open your mouth. Okay, we're going to take a look at the teeth and the gums. Okay, and I'm just going to get in the pocket into the cheek here. Okay, look at the oral mucosa here. Salivary glands. Okay, I'm just going to pop that down. Okay, and the upper lip here. Good. Okay, so if I could have you just lift your tongue to the roof of your mouth. Okay, good color. No central cyanosis. The floor of the mouth looks good. Okay, and if you could stick your tongue out. Right, no scallop marks. Good coating. All pink, not overly pale or red. Okay, and now stick it out as far as you can go. We'll just put that right take a look at the pharyngeal wall. Look at the tonsils and the throat for signs of irritation or disease. Looks all pink and smooth and clear. Okay. And if I could just have you say "ah" for me. There we go. Okay, good. Go ahead and close your mouth there. Let me just jot that down. Non-irritated. Okay, there we go. Let's go ahead and take a little peek at your ears. So, let's see if we get some cooperation here. There we are. A little bit of light. Okay. I'm going to take a peek in your ears. So, I'm going to pull up and back here. And we're just going to look inside the ear. Okay, so ear canal's only a few centimeters long, and it is clear. There's no earwax past the little hairs here. No obstruction. Tympanic membrane there. And there's our malleus and cone of light. Okay. And the other side here. There we are. Okay, so clean ear canal. The tympanic membrane is pretty translucent and it has this sheen to it. So we call it a pearly gray color because of that sheen. Looks quite like the sheen on a pearl. And it's intact. No bulging. I can clearly see the tip of the malleus, and we've got our cone of light. So, and this here's also all good. Have you been having any issues with your hearing at all? No? Okay. So, otoscopy. There we are. So let's take off the speculum. Throw that away, and then we can look at the nose here. So I'm just gonna have you tip your head back, and we'll take a peek inside each nasal passage. So we have nice pink and moist tissue here, and septum is intact on this side. Terminates look okay. And same on this side, so our septum is midline and intact. Nasal passages are clear with turbinates visible. Those look just fine. Okay. And then we're going to be testing your sinus cavities. So you have sinus cavities in the frontal area, the ethmoid, and maxillary areas here. So right here, and here. I'm going to be tapping on these, and you let me know if they're tender at all, okay? Alright, so we're just going to tap. Okay, tap. Alright, we'll start on one side of the ethmoid. Sinus is here. Tap. Okay. Good. One side of the maxillary. Okay, and the other side. Any pain or tenderness? Okay, and what if I do this? 2 fingers. No. Good. All good. Okay, excellent. So we had our nose, so nasal passages, clear, pink, moist, septum midline, and intact. So let's take a little peek at your eyes. So I'm going to start with a little visual inspection of the eyes. So we're going to look at the lacrimal glands here. Pink, moist. We have the orbit, eyebrows, eyelashes, the sclerae, irises, pupils. Okay, so in this light, the pupils are of equal size and round, and appropriate for the type of light we've got going on. They're not overly dilated or constricted, and sclerae are gray-white, eyelashes, eyebrows intact. I'm going to just pull down on your eyelids. I want you to look up. Good, and I'm going to pull up, you look down. Okay, pink and moist. So if I could just have you look right here for a moment. Okay, go ahead and look right here. Good. Just keep looking. It's about at my nose, so look right at my nose here. Good. Just checking your pupillary response. So your pupils are reactive to the light. Good. And if you could look right here for a moment. And back at my nose. Good. We're just resetting your eyes. Okay. Good. I'm going to have you look at my fingers right here and follow them using your eyes without moving your head, okay? So let's check up and down, up and down, up and down. Good. How about from the side to the side, side to the side, to the side. Good. Diagonally up, diagonally down, up, down, up, down, and up here, down here, down, up, down. Okay, excellent. Keep following my fingers here. We're just going to move your eyes from the middle to each of our directions. Good, and follow them in and out, and in and out, and in. Other side, and out. Out, in, and out. Excellent. Okay. So, PERRL. Pupils equal reactive to the light. Round reactive to the light, and then cranial nerves 3, 4, 6 intact, and accommodation, reflex intact as well. So let's take a little peek at your nodes. You have quite a few lymph nodes from the chest up. You have some behind the head here, behind the ears, in front of the ears, some around here, under here, back here, all around the neck, and above the clavicle. So we'll start to get under the hair here, the occipital nodes, post-auricular nodes, pre-auricular nodes. Okay, we have the parotid gland here, jugulodigastric, submental, submandibular. Okay, and on the neck, what we have as our guiding force is this big ol' muscle right here called the sternocleidomastoid. We have nodes that are in front of it, behind it, and under. So we have anterior cervical, posterior cervical, and under the SCM, deep cervical chain. And then we have the supraclavicular nodes. Right above the clavicle. Okay, and then we have the thyroid here, so I'm going to just palpate around. take a dry swallow here. So just like that. I can see if I can feel the thyroid here. Just swallow. Good. Okay. Last thing here. We are going to auscultate and palpate the carotid arteries. So I'm going to listen and have you hold your breath so I don't hear the rush of air in your throat. And I'm going to have you take a deep breath in and hold. And we're listening for audible heart murmurs known as bruits. And exhale. Inhale and hold. Exhale. Okay. I'm just going to palpate here since there aren't any murmurs there. Good, and the other side here. Perfect, okay. So, with my stethoscope still in, we're going to listen to your abdomen. So, I'm going to have you just breathe normally, and we are going to work our way around and listen to the digestive sounds. And if at any point you feel any pain or discomfort, just let me know. Perfect. All right, so I am going to use our percussion to map out where our organs are and listen for any fluid in the abdomen. So, like before, we're just going to tap, 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 tap around. And I can mark out where the liver is, for example. Just gonna listen around. Good. And now we're gonna do some palpation here. So let me know if there's any pain or tenderness here. So we're going to go general to start. Feel for any guarding or rigidity, tenderness. And then I'm going to feel the liver, the spleen. See if I can feel the kidneys. Okay, good. All right. Okay, and abdomen was non-tender. good there. Okay. So, we're going to do a couple little neurological tests. I am going to be touching you on your face, and I just want you to tell me when you feel the touch, okay? Alright, go ahead and close your eyes. Alright? Good. Yep. Mm-hmm. Good. Yes. Mm-hmm. Yep. Good. Mm-hmm. Yep. Excellent. Now I'm going to do that on your arms and your legs now as well. So I'm just going to touch you somewhere on your arms or your hands. I want you to tell me when you feel that touch. Good. Mm-hmm. Yep. Mm-hmm. Good. Mm-hmm. Yes. There we go. Good. Mm-hmm. And now let's move to the legs and feet here. So, okay. Good. Mm-hmm. Good. Yep. Mm-hmm. Yes. Yep. Good. And good. Okay. Let's go ahead and check some muscle strength now. So, first, I'm going to put my hand on the side of your head. I'm going to have you turn your head against my hand, okay? If I put my hand here, I want you to turn against it. Okay? Other side, go ahead and turn against my hand. Good. If I put my hand here, if you could press your head against my hand. Good. And if I do the back of your head, if you could press against my hand. Good. I'm going to put my hands on your shoulders. I want you to shrug up against them. Go ahead and shrug. Good. I am going to have you do one of these. I'm going to try to push you or pull you, and I want you to resist me. So I'm going to try to pull you, have you resist, and I'm going to try to push you, and have you resist. Good. And if I could just have you put your hands like this, I'm going to have you push up against my hand or down. Lift the hand up. Press the hand down. Lift the hand up. Press the hand down. You put your hands like this. I'm going to try to put the thumb down. I want you to resist me here. Now I'm going to make a little pincer grip like this, if I could have you do the same. And I'm going to try to break your grip, okay? Just hold on to that grip. Okay, and if I could have you grasp my fingers here and grab them as hard as you can. You're not going to break them, I promise. That's why we're using 2 fingers, not just 1. Good strength there. I am going to press down on your thighs. I'm going to have you press up against me. Good. I'm going to push against your legs, your lower legs. I want you to kick them out against me. I'm going to try to pull your calves towards me. I want you to resist me. Good. Now with your feet, I'm going to try to press them down, pull them up. I want you to resist me here. So I'm going to try to go down, and I'm going to try to pull up. I'm going to try to push down, and try to pull up. Okay, good strength. So let's check our reflexes. So I'm going to have you put your arm on your leg so that your hand just dangles between your legs. Good. And I'm going to tap on the back of your elbow here. Good. And then I'm going to hold on to your arm, and I'm going to tap on my thumb right in the crook of your elbow. Okay, switch arms. Good. So back of the arm here. And then the elbow, or our biceps reflex. Okay, now the knee jerk reflex. Pretty easy here, just let your legs relax. Those are pretty easy. And that was pretty easy. Last reflex, I'm going to have you put your foot on my leg here. Okay, and I'm going to hold your foot and I'm going to tap on the back of your ankle, on your Achilles tendon here. There we go. And if you could switch your feet. Okay, I'll hold on to it. And you can put it down. So I'm going to have you stand up for a moment so we can test your gait. So if I could have you walk to the other side of the room, just normally. And if you could come back walking on your toes. Good. Can you go back walking on your heels this time? And come back walking one foot after the other, heel to toe. Yeah, like the drunk walk. Yeah, the field test. Okay, very good. Go ahead and sit down. Our neuro tests here. And intact. Sensations, that's cranial nerve number 5 on the face. And we have all of our spinal nerves along the body. Good muscle strength. Intact reflexes, triceps, biceps, patellar, and the Achilles. And good gait and balance. Alright, I'm going to do a little dermatological examination now. I'm going to take a peek at your skin. I'm going to do an inspection first, and then we'll also take a look at your nails. Do you have any skin concerns at all? No? Okay. So overall, there's some texture, of course. Human skin is just textured in places. Not much in the way of hyperpigmentation. A couple of scars. Freckle here and there. But they're small, one color, and round. So I'm going to take a little feel here. So I'm just going to feel the texture of your skin here. Good. Yeah, no, that's all about homogeneous. Okay, now can I look at the backs of your elbows? We'll look for any plaques here, indicative of plaque psoriasis. Okay, can you show me your nails? Okay, so a little on the dry side, but otherwise no tar staining, cholesterol deposits, or nodes. Skin is clear. No erythema. And the nails, there's no split hemorrhaging, no little white spots. The half moons look nice. They're all pink. All good. Okay. And can I see your shins? If we have skin abnormalities on the legs, that's usually where they're at. Okay, those look good. So finally, I'm just going to test your pulses and look at your joints. So we have radial, ulnar, brachial. We'll start there. Radial here, ulnar, and the brachial pulse. Radial, ulnar, brachial. Okay, and in the legs we have the popliteal behind the knee. This one. Okay, the post-tib pulse. One foot here, and the other one. And dorsalis pedis on the top of the foot. Good. Okay. I'm just going to look at your elbows real quick. Are they tender at all when I squeeze them? No? Okay, how about the wrists? No? And if I squeeze on the finger joints, is any of this painful? Nope. Other hand. And what if I squeeze the hand like this? Squeeze the metacarpals. Nope. Okay, I'm going to do some tapping here on the carpal tunnel. And let me know if you get any numbness, tingling, or pain. Okay. All right, so nothing on the Tinel test there. All right, anything with the knee? If I palpate around. No? How about the ankle here? Okay, no edema. And if I squeeze the toes, any pain? No? Okay, so let's go ahead and our derm exam. Slightly textured. That's post-inflammatory. Hyperpigmentation that'll eventually go away. It takes a long time, but it will. And then we had weren't any lesions out of the ordinary. Clear, so no plaques. And then non-tender. The temperature was normal. Okay, let me just take a peek at what we've got going on. We did our screening. And you're not up for any screenings at this point either. Those are all up to date. Okay, that all looks great. Do you have any questions for me, or is there anything that you would like me to have a look at that you don't think I hit in the exam? Okay, well, I am sending you home with a clean bill of health here. That all looks great, so I don't have anything else for you except that I hope I don't see you until next year, so that means that nothing went wrong with your health. Okay, well, let me go ahead and just sign off in here and close my laptop. All right. I'd like to thank you so much for coming in for your annual physical examination. I hope you have a whale of a day and a good rest of your night. I hope you enjoy this warm weather with all the motorcycles and such out and about.